Aging brings a range of normal physiologic changes, but the rate and degree of these changes are different for each individual, and they do not happen evenly across all organs. One part of the body may appear to age quickly, while another seems to function well for many years. This uneven pace is influenced by factors such as genetics, daily habits, and long-term environmental exposures. For example, naturally occurring mutations build up in stem cells over time, but each organ collects these changes in its own way. Although it can be unsettling to think about the body becoming more vulnerable, it may help to know that many of these shifts are simply part of the normal aging process. Studies suggest that genes explain only a portion of why people live longer or shorter lives. Lifestyle and environment, things like diet, activity level, and exposures throughout life, also play a large role. As people reach very advanced ages, such as 90 or 100, genetics appear to contribute more strongly. But even then, aging remains a mix of internal and external influences. In general, these normal age-related changes increase the body's susceptibility to illness and reduce its ability to recover quickly from stress. Understanding these changes can make it easier to recognize what is expected, what can be managed, and when to seek help. Age-associated physiologic changes. Physiologic rhythms. The body relies on natural daily rhythms to control sleep, hormone release, and temperature. With age, these rhythms remain present but become less synchronized and slightly earlier in timing. For instance, older adults often get sleepy and wake up earlier. Hormones that normally rise and fall in pulses, such as growth hormone, melatonin, and ACTH, release in smaller amounts. The daily curve of cortisol stays intact but becomes flatter, with slower increases in the morning. These changes partly stem from gradual cell loss in the brain's internal clock, making it harder for the body to reset itself when routines change. Although these shifts are normal, they can sometimes make sleep patterns feel less predictable. Loss of complexity. Healthy bodies make constant small adjustments to keep internal conditions stable. With aging, these fine-tuned adjustments become less flexible. Heart rate, blood pressure, and brain electrical activity all show less variation from moment to moment. This doesn't usually cause symptoms on its own, but it does mean that the body may not react as quickly to challenges such as illness, dehydration, or stress. The good news is that some of this decline is not permanent. For example, physically active older adults can maintain healthier heart rate variability compared with sedentary peers. Homeostasis. Aging gradually reduces the amount of reserve the body can pull from when under stress. This process, called homeostasis, means that even ordinary challenges can take a greater toll. For some people, the reserves shrink enough that small problems produce sudden symptoms such as confusion or weakness. Frailty describes the point where these reserves are almost fully used just to maintain everyday stability. The concept helps explain why illness is present differently in older adults. A single symptom, like confusion, may appear during very different medical problems because the reserve that normally protects mental clarity is easily overwhelmed. While this can be frustrating, recognizing it helps families and clinicians respond more quickly. Nonlinearity of aging. Finally, aging doesn't proceed at a steady pace. Certain stages, around the mid-40s and again around 60, show noticeable shifts in blood-based markers, reflecting periods when the body undergoes more rapid physiologic change. Hematopoietic system. The hematopoietic system, your body's blood-forming system, continues to function throughout life, but it gradually loses some of its backup strength. Bone marrow, which produces red cells, white cells, and platelets, becomes more replaced by fat as people age. This change does not usually cause symptoms, but it does mean the system reacts more slowly when the body needs extra blood cells, such as after blood loss or illness. Stem cells in the marrow become less diverse and less efficient. so the response to challenges like low oxygen or infection may be delayed. Older adults often develop clonal blood cell groups, meaning a portion of their white cells share the same genetic pattern. This becomes very common after age 90. These clones usually cause no symptoms, but they slightly increase the risk of blood cancers and can be linked to higher overall mortality. Men may also lose the Y chromosome in some white cells, a normal age-related finding that carries similar risks. Red blood cell lifespan stays normal, but chronic low-grade inflammation and aging can interfere with iron handling, making anemia more likely when the body faces stress. White cell numbers remain fairly steady, although their function becomes less robust. Platelets become more reactive with age, responding more strongly to clot-triggering signals. Several clotting factors also rise. Together, these changes create a more pro-clotting state, which contributes to the higher risk of blood clots in older adults. Overall, the system still works, but it has less reserve and responds more slowly when needed. Gastrointestinal tract. Aging affects the digestive tract in many small ways that add up to noticeable changes in chewing, swallowing, and how the stomach and intestines move food. In the mouth, the lining becomes thinner and gums recede, making teeth more prone to decay. Saliva production decreases, which can cause dry mouth and make chewing or swallowing feel less smooth. The tongue loses some strength and coordination, and protective swallowing reflexes may weaken, raising the risk of aspiration. In the esophagus, the muscle contractions that move food downward become weaker and less coordinated. Although food usually still moves effectively, older adults may have more reflux. At the same time, the esophagus becomes less sensitive, so severe reflux may cause fewer symptoms. The stomach generally maintains acid production, but healing from irritation is slower. Older adults are more sensitive to stomach irritants, such as certain medications. The stomach empties food more slowly, and the specialized cells that coordinate movement decline over time. In the small intestine, nutrient absorption remains mostly adequate, though calcium and some micronutrients may be absorbed less efficiently. Bacterial overgrowth becomes more common and can affect digestion and cause gas or bloating. The large intestine moves stool more slowly, contributing to constipation. Nerve cells that sense distension decline, so pain from conditions like appendicitis may be less noticeable. Anal sphincter tone decreases, and the risk of partial leakage rises. Diverticula, small pouches in the colon, form more easily because the bowel wall weakens and pressure increases. The liver becomes smaller and processes medications more slowly, while the gallbladder tends to form more cholesterol stones. The pancreas shows mild aging changes, but usually continues to function well. Renal system. The kidneys gradually lose size and filtering capacity with age. Between 30 and 80 years old, kidney mass may drop by up to 30%, mainly due to loss of filtering units in the outer cortex. Some glomeruli scar, and blood flow through the kidneys decreases. These changes do not necessarily cause symptoms, but they reduce the system's ability to handle stress like dehydration, illness, or medication effects. Even though filtration decreases, blood creatinine levels may not rise because muscle mass, where creatinine comes from, also falls. This makes kidney function appear normal on basic labs, even when filtration has declined. Older kidneys also rely more heavily on prostaglandins to maintain blood flow, which is why medications such as NSAIDs can more easily trigger kidney injury in older adults. The kidney's ability to concentrate urine weakens. Older adults cannot conserve water as effectively during dehydration, and they cannot dilute urine as well during excess fluid intake. These limitations make both dehydration and fluid overload more likely. Tubules lose efficiency in handling acids, glucose, and amino acids. After injury, repair is slower and often incomplete because aging kidney cells are more vulnerable and have reduced regenerative ability. Hormone functions also change. The kidneys activate less vitamin D, contributing to bone loss. Aldosterone response becomes weaker, affecting salt and volume regulation. However, erythropoietin production in response to anemia generally remains adequate, though some studies show a blunted response. Taken together, the aging kidney still performs daily tasks well, but is much less resilient to illness or medication stress. Cardiovascular system. The cardiovascular system adapts to aging by working harder behind the scenes to maintain normal function. At rest, the heart often performs well, but its ability to respond to stress, illness, or heavy exertion decreases. The heart muscle becomes stiffer, especially the left ventricle. This makes it harder for the heart to fill quickly, so the atria take on a larger role in pumping blood forward. As a result, older adults depend more on normal heart rhythm. Irregular rhythms like atrial fibrillation can cause rapid drops in heart function. The left atrium enlarges and the heart wall thickens, while the heart's pumping strength, ejection fraction, usually stays normal at rest. Increases during exercise are smaller than in younger adults. The maximum achievable heart rate declines steadily with age, even in physically fit individuals. Heart muscle cells, cardiomyocytes, become fewer but larger, and the natural pacemaker cells in the sinoatrial node decrease, contributing to slower responses to stress and greater sensitivity to certain medications. Large arteries, including the aorta, stiffen significantly. Stiffer arteries cause pressure waves to return to the heart faster, increasing the workload and widening pulse pressure. This is a major contributor to age-related high blood pressure. Stiff arteries also reduce blood flow to the brain during activity, and the rate of stiffening can be worsened by hypertension or slowed by exercise. Together, these changes make the older heart more vulnerable. Heart attacks, heart failure, and drug-related heart problems tend to have more serious effects in older adults because the cardiovascular reserve is reduced. Still, regular physical activity can soften many of these declines. Respiratory system. The lungs and breathing muscles undergo several structural and functional changes with age. These changes do not usually cause breathing problems at rest, but they reduce reserve capacity and increase vulnerability to illness. Air sacs, alveoli, enlarge as elastic tissue breaks down, reducing surface area for gas exchange. Elastic recoil decreases, making it harder to fully exhale. This leads to more air remaining in the lungs at the end of each breath and less efficient airflow during exertion. The lining of the airways and the protective surfactant layer also change, shifting toward a more inflammatory profile. Ventilation becomes uneven. Parts of the lungs close off during normal breathing, especially when lying down. This increases the difference between oxygen in the air sacs and oxygen in the blood, the A gradient, contributing to lower oxygen levels during exercise or illness. Although carbon dioxide removal stays normal, oxygen levels decline with age, particularly during exertion or at altitude. The chest wall stiffens and the diaphragm flattens, making breathing more effortful. Older adults rely more on accessory muscles, which are less effective in seated or lying positions. Cough strength decreases due to weaker respiratory muscles and higher airway closing volumes. Mucociliary clearance slows, making it harder to remove mucus and increasing susceptibility to pneumonia. Recovery from lung injury is also slower. Despite these changes, physical activity helps maintain respiratory strength and can significantly improve functional breathing capacity. Genitourinary system. Aging affects the urinary and reproductive systems in ways that can be subtle at first but become more noticeable over time. The bladder becomes less flexible and less able to hold large volumes of urine. The detrusor muscle, which generates the force needed to empty the bladder, loses strength, and the nerve signals coordinating bladder contractions become less reliable. As a result, older adults may experience more urgency, nighttime urination, or small leaks. Post-void residual volume. The urine left behind after emptying often increases, which can also contribute to frequency or infection risk. Changes in the brain's control of bladder function, particularly reduced dopamine signaling, explains why many older adults experience the combination of urgency, poor emptying, and nighttime symptoms even without obvious local disease. Women experience additional changes after menopause, as estrogen loss shortens the urethra and decreases closure pressure, making leakage and infections more likely. Topical estrogen can help restore some of this function. Men experience weakening erections, reduced ejaculate volume, and longer recovery between erections. These changes reflect combined effects on nerves, blood flow, and hormone patterns. Sperm production decreases, and sperm quality becomes less reliable. The prostate commonly enlarges with age, contributing to weak urinary flow or incomplete emptying. Both men and women experience shifts in the urinary tract's microbiome, which becomes more diverse with age. While research is ongoing, changes in these bacterial communities may influence bladder symptoms or infection risk. Overall, the genitourinary system still functions, but its coordination, strength, and reserve gradually decline. Musculoskeletal system. The musculoskeletal system experiences some of the most visible age-related changes. Muscle mass declines steadily, accelerating in later decades, and the quality of muscle tissue also shifts. More fat and connective tissue infiltrate the muscle fibers, reducing strength and power, a process known as sarcopenia. Strength loss is often greater than the amount of muscle loss itself, partly because fast-twitch fibers shrink more than slow-twitch fibers. Nerves that activate muscle fibers decrease in number, leaving remaining motor units larger but less precise. These changes make muscles fatigue more easily and reduce the body's ability to generate quick or forceful movements. Recovery from injury slows because the satellite cells responsible for muscle repair become less effective, regardless of physical activity level. Mitochondrial efficiency declines in typical aging, reducing energy supply during exertion, though active older adults can maintain near-youthful mitochondrial function. Bone structure also changes. Both cortical, outer, and trabecular, inner, bone lose density, and the microarchitecture becomes thinner and more fragile. The internal channels in bone widen, and bone-forming cells become less responsive, while bone-resorbing cells remain active. This imbalance increases fracture risk. The repair process after fracture is slower because blood vessel formation and bone-building activity are reduced in aging bone. Vitamin D activation by the kidneys decreases, further contributing to bone loss. The combination of weaker muscles and thinner bones increases the risk of falls and injury. However, weight-bearing and resistance exercise can meaningfully slow these changes and support both muscle and bone health. Central nervous system. The central nervous system undergoes gradual but meaningful changes with aging. Brain volume decreases over time, especially in the frontal and temporal lobes, and white matter loss exceeds gray matter loss. Blood flow to the brain decreases, and the mechanisms that stabilize cerebral blood flow during blood pressure changes become less efficient. Neurons shrink, lose branches, or reduce their number of synapses. Although actual neuron loss is modest in many brain regions, the reduction in synaptic complexity contributes significantly to age-related changes in cognition. Some areas of the brain accumulate lipofuscin, plaques, or tangles, even in people with normal cognition. These changes increase with age but do not always indicate disease. The brain compensates for losses by recruiting additional regions during tasks, a strategy known as scaffolding. This explains why older adults may use more widespread brain networks to complete tasks that require smaller regions in younger adults. Neurotransmitter activity changes with age. Acetylcholine declines due to reduced neuron numbers and lower release levels. Dopamine availability decreases in key regions, which affects memory persistence and processing speed. These changes contribute to slower thinking, reduced multitasking ability, and more effort required to learn new information or solve unfamiliar problems. However, well-practiced skills, vocabulary, and long-term knowledge remain stable or even improve into later life. Cognitive training, social engagement, and mentally stimulating activities can help preserve function by strengthening alternative pathways and improving compensatory mechanisms. Skin. The skin becomes thinner, less elastic, and more fragile with age due to changes in both the epidermis and the dermis. The outer layer renews itself more slowly because keratinocyte division decreases and the dermoepidermal junction flattens. This makes the skin more prone to shearing injuries. Something as simple as removing an adhesive dressing may tear the upper layers. Moisture loss increases because lipid production declines, leading to dry, itchy skin. The dermis loses collagen, sometimes as much as 75%, and the collagen that remains is more disorganized. Elastin fibers become fewer and less connected, reducing elasticity. Glycosaminoglycans decrease, reducing the skin's ability to hold water and maintain smoothness. Together, these changes slow wound healing and contribute to wrinkling and sagging. Sweat and oil gland activity decline, reducing the skin's ability to regulate temperature and stay moisturized. Older adults may have more difficulty dissipating heat because the blood vessels in the skin respond less effectively and sweat production drops. At the same time, subdermal fat thins, reducing insulation and increasing sensitivity to cold. Age also affects sensation. Touch and vibration receptors decline in number, particularly in the lower extremities, which can affect balance and injury detection. The skin produces less vitamin D because levels of 7-dehydrocholesterol decrease with age. The skin's microbiome becomes more diverse, and senescent cells accumulate, reflecting overall aging patterns. Many of these changes can be improved with topical retinoids, which encourage collagen renewal and increase epidermal thickness. Sensory system. Aging affects several sensory systems, but the eyes experience some of the most noticeable changes. The tissues around the eyes lose elasticity, leading to drooping lids or inward or outward turning of the eyelids. Tear production decreases, yet watery eyes may become more frequent because the drainage openings shift position and function less effectively. The conjunctiva thins and yellows slightly. Corneal sensitivity falls by around 50%, meaning minor irritations may go unnoticed. Cholesterol and fat deposits may form at the cornea's edge, arcus senilis, a common age-related finding. The iris stiffens, and the pupil responds more slowly to light. Meanwhile, the lens yellows and hardens, making it harder to focus on close objects, presbyopia. This also reduces the ability to see blue tones clearly. Inside the eye, the vitreous gel shrinks and separates into liquid and solid components, leading to floaters or flashes. The retina thins as neurons decline, while the retinal pigment epithelium thickens. Retinal blood flow decreases by about 20% in older adults. Together, these changes reduce the ability to adapt to low light, increase sensitivity to glare, and weaken contrast vision. Other senses show age-related decline as well. Touch and vibration sensation in the skin drop because receptor cells diminish. These changes may affect balance and reaction time. Although these sensory shifts are normal, understanding them helps older adults modify lighting, contrast, and safety practices to maintain independence. Longevity. Research on longevity shows that no single factor determines how long someone lives. While it may seem intuitive that people with healthier immune or inflammatory profiles would live longer, most long-term studies have not found strong, consistent connections between these measures and actual lifespan. Instead, many typical downstream problems, such as inflammation driven by chronic illness, are more often consequences of aging rather than independent causes of longer or shorter life. Lifestyle factors, including diet, physical activity, and overall health habits, show clearer links to longevity than immune or inflammatory markers. Studies also suggest that certain personality traits, like conscientiousness or maintaining an active lifestyle, may contribute meaningfully to longer life. Although numerous studies have tried to correlate specific biological markers with exceptional longevity, most findings lack consistency across populations. Exceptional longevity appears to result from a combination of genetics, environment, and behavior, rather than any single measurable factor. Conclusion: aging affects every major organ system, gradually reducing reserve and resilience. Although these changes can make the body more vulnerable, understanding them helps older adults, families, and clinicians anticipate needs and respond early to concerns. Many age-related shifts are predictable and manageable, especially when supported by healthy habits, clear communication, and appropriate medical care. While no single factor determines longevity, maintaining function, preventing complications, and supporting overall well-being can make aging a safer and more comfortable process. If you found this video helpful, please consider subscribing to my channel. If you need a deeper dive into any of the above points, please leave a comment.